Okay. I want to welcome everyone to our Medicaid Sister Advocate Social. We in Moot Health Equity started this endeavor the first of the year. Once the details of the big, beautiful bill were known and the potential impacts of it were made aware to us, it got me angry. And rather than sitting there stewing in and have my blood pressure rise, I decided to do something. And I know I've been involved since Medicaid expansion, Dan and I, with trying to get to a point that we optimize enrollment in Medicaid. Given that we don't have a universal health care coverage, how do we get to a point that we take the things that we have available to us and make sure that all people who are eligible get enrolled? So to the extent that there are people who are eligible in our community who should have Medicaid, we wanted to make sure that they had access to that. And so we started going to community events, health fairs, and those kinds of things, helping people get through this. And so I've been doing this for about 3 or 4 years. So but that was on a one-off basis. It never occurred to me to put together an army. And so this is my army now. And so how do we get to a point that we have people who are willing to roll up their sleeves, work together to help those who are less fortunate, to make sure that they can get and maintain healthcare coverage? And so part of doing that, of looking at all the people who are involved, social services plays a major role in this. They are in fact, people who actually enroll you in Medicaid. So no Medicaid happens without these ladies here. And this gentleman who just walked in, they represent both Albemarle and Charlottesville social services, who we want to work collaboratively with and in partnership with, in order to make sure that as we help people and funnel them to you, that we're getting them there to you with the right information that you need in order to make sure that they process the applications. And so making sure that we know one another, know what the requirements are, and can work hand in glove is the whole purpose of this event. And given that we're 6 months out now from a D-Day, and so the question is, how do we make sure that this Army is well trained, has been drilled in terms of what it needs to know and do, and how can we make sure that we do that? The other part, the things that we don't have control over are the people writing the rules. So far, CMS has not published final regulations in terms of how they want to see all of this stuff operationalized. The state on their level is trying to anticipate that and thinking that, read the tea leaves, trying to figure out what they think is going to happen. And they're trying to gear up for that as well. So we're going to hear a little bit from them in terms of what they're hearing locally. And then also, how do we make sure that as we go forward, we work well together? And so I've asked one of the folks who does a lot of the training for Medicaid enrollment stuff to help us. I've been working with the Virginia Healthcare Foundation from the very beginning. I told you my initial certification or course was with them some 5 years ago. And so they're the people who I go to for information. I'm glad that they're able to join us this evening to kind of give us an update in terms of as they sit, where they see things and how they see things rolling up. So Joanna, who is the Chief Policy and Strategy Fellow for the foundation, is going to give us a brief presentation in terms of how they see things right now. Joanna, if you would start, please. Thank you.
Sure thing. Thank you so much, Greg. I'm just doing a tech check to see if everybody can hear me okay in the room.
Yep.
Okay, awesome. And y'all are coming in loud and clear too, so that's great. Thank you for that introduction, Greg, and for all you do and all everybody in the room does. I see Dan as well. I believe it's very small for me, but I think it's you, Dan. Hey, and hey, everybody. Thank you for being here tonight. I think Some of this is probably things you already know, but basically, as Greg said, I'm just going to tell you everything we kind of know so far as the Virginia Healthcare Foundation. Um, and just thank you for having me. So I'm coming to you live from Richmond. It's always great to see Charlottesville virtually. I'm a UVA grad, so love Charlottesville and excited to be with you. So next slide, please. Yeah, so just a little bit about the Virginia Healthcare Foundation. We are a public-private partnership, and we've been around for over 30 years. So we've gone through lots of different coverage transitions over the years with healthcare. And our mission is really to increase access to healthcare for the uninsured and medically underserved in Virginia. So, Greg, you said it so well, but we share your goal so much and are so grateful for the work y'all do to get everybody who is eligible out there enrolled and help them stay enrolled. And so our work really centers around that. And you mentioned our Sign Up Now trainings, which I know folks in the room have taken or will be taking, and we warmly welcome you all. We're working on updating those this summer as we get more information on all these changes. So would love to have y'all come back and take another one too. Next slide. Yeah, so all these upcoming changes, we kind of refer to this bill as HR1 because it's the shortest name that it has. It has several names, one big beautiful bill, working families tax cut. But the bottom line is this new law makes major historic changes to the health and social safety nets nationwide. And I think a couple takeaways here for us and the work that we all do is that each change has its own implementation date. So I think that's one of the things that makes this new law confusing, right? There's lots of different dates, lots of different things happening at different times. We're going to focus on Medicaid today. But I think this third item is really the takeaway in Virginia, which is that uh, the major Medicaid changes in Virginia, how this will work in Virginia, they will primarily directly impact coverage for adults who aren't pregnant. So this is like our Medicaid expansion group, which Greg mentioned earlier. Virginia expanded coverage to adults in 2019. So this is still relatively new in the scheme of Medicaid, but now unfortunately these changes are coming in and are going to further affect who's eligible. So next slide, please. Yeah, so I'm just going to hit on the major changes today. I'm happy to come back when we have more info or to go over more. But kind of highlighting, there's so many things in HR1. These are the big ones around health coverage. So the first thing coming up is that there are new restrictions on eligibility for immigrants. So HR1 eliminates Medicaid coverage, marketplace subsidies, and Medicare coverage for certain legally present immigrants. The Medicaid provisions start in October, and we'll talk about those in the next slide. But again, the takeaway here, and I get this question a lot, the one bright spot here is that in Virginia, because of some policy decisions we made in the past as a state, this will not impact Medicaid coverage for kids or for pregnant people. But it will impact coverage for adults. And then similar changes are going into effect for the marketplace, so the ACA marketplaces, and for Medicare in January. Um, this second one is a little bit more in the weeds, but especially if y'all work with like hospitals or people coming out of the hospital, this will impact them. So right now, there is a thing called retroactive coverage, and that means that people can actually get Medicaid to go back in time up to 3 months before their application and pay for old bills, which can really help if like somebody's coming out of the hospital, they recently had an accident, and HR1 limits that amount of time to 1 month for Medicaid expansion adults and 2 months for everybody else. So that starts in January. And then the last two on this slide, which I'll go into in a little bit more detail in just a minute, I think, they really go hand in glove. The more frequent renewals and the work reporting requirement, and those are coming up in January. Those are for our Medicaid expansion adults, and they really go into effect together and work together. Um, okay, so next slide, please. So, starting with the restrictions to eligibility for our non-citizens. Again, this affects our non-pregnant adults who are age 19 and older. The current rule, non-pregnant adults can qualify if they have various immigration statuses, refugees, asylees, humanitarian parolees. They can qualify for Medicaid right now. What's happening in October is that for non-pregnant adults, there's only going to be three immigration statuses that will qualify somebody for Medicaid. However, again, the one bright spot in Virginia is there's no change for kids and no change for pregnant people. Next slide, please. So this is a lot on one slide, but this is just something for you to be able to reference back to. But this really is just meant to illustrate. So on the left, you see the current eligibility for immigrants, for adults who are over 19. And then on the right-hand side, you can see the much shorter list that'll start in October. So in October, if you're not pregnant and you're 19 or over, you have to basically be a lawful permanent resident, Cuban or Haitian entrant, or COFA migrant in order to qualify for Medicaid coverage. And a lot of our lawful permanent residents, so these are our green card holders, they will have to still meet that 5-year bar. So they kind of have a 5-year waiting period before they can get Medicaid coverage, although there are some exceptions. And we'll certainly have more details and screening tools as we get closer to this date. And then just, one more time, doesn't affect kids, doesn't affect pregnant people. And then next slide, please. So last thing on these changes, I just want to share like what we know now about how this will be implemented. Greg teed it up really well about how on a lot of this stuff, we're still waiting for some guidance from the federal government, still kind of figuring things out. But this is what we know right now on how this eligibility restriction for immigrants will go into effect. So non-citizens who are applying for Medicaid on or after that October 1st date, they'll have their eligibility determined using the new rules. So they'll have to be in one of those three immigration statuses. And that's again, if they're an adult who's not pregnant over age 18. If somebody, so we know that people are going to lose their coverage, right? Because we have that long list of statuses that qualify now. So this summer, the state is going to be mailing notices to impacted Medicaid enrollees requesting that they report changes. So if they've had a change in their immigration status that might qualify them on an ongoing basis, they need to report that to the state. So those notices will go out later this summer. And then, unfortunately, right, if somebody is no longer eligible because their status no longer qualifies them for Medicaid, they will lose coverage. So they'll be moved into what's called emergency services Medicaid. This is really limited coverage that truly only covers an emergency, and that'll be effective October 1st, so that implementation date. Let me pause for a second and just see if there's any questions on this before I go into the work requirements and 6-month renewals. Okay.
Well,
Great.
Joanna, I think we ought to point out that those
Yeah,
individuals in that, can you hear me?
I can. Yeah.
Okay. Those individuals who lose Medicaid because they don't meet one of those immigrant criteria for
Yes.
qualification, there are some of those who will continue to be qualified though through the marketplace. So a special enrollment will be in effect at that time for them. And it'll be important that we find as many of those that we can continue coverage for if they are eligible. They're restricted too because they have to have the income requirements, but they don't have to, not all of them have. And
hmm
that's
Yeah, absolutely, Dan. And, unfortunately, a lot of the similar changes are going to go into effect in the marketplace in January. I think, to your point, we're kind of waiting to see what the state does around state subsidies, because if some state subsidies come into play, it's possible, depending on how that all shakes out, that a lot of people might actually be able to transition from Medicaid over to the marketplace in Virginia. Um, through a special enrollment period, exactly like you said. So this is like everything on here. It's a broken record, but it's, more to come. We're still kind of waiting on specifics there. Great point. Okay. Next slide. And then I'm just going to briefly go through the work requirement and 6-month renewal pieces. I just have a few more slides left. So these go hand in hand, as I mentioned. Right now, we know that all Medicaid members have to renew their coverage annually. So every 12 months, they go through the renewal process. And while we know that current income is reviewed and looked at application and at renewal, Medicaid has no requirements, right, to work or participate in any sort of activities. That's not a part of Medicaid eligibility now. And so the new rule is that expansion adults, so these are 19 to 64-year-olds who are not on Medicare, will have to renew their coverage every 6 months instead of every 12 months. And expansion adults must also demonstrate that they work, volunteer, participate in a similar program for at least 80 hours a month. They can be in school at least part-time, or they can meet an exemption to qualify for Medicaid. And this all comes into place starting in January of 2027. Next slide, please. So I'm not going to read the next couple of slides, but I'm just going to pull out some highlights. So satisfying work requirements. So to meet them, you have to basically do that 80 hours a month of activity. Can be work, can be a work program, volunteering, or a combination therein, or be in school at least part-time. There's also this interesting part of HR1 that says you meet the work requirement if you can show you have income of at least $580 a month, because that is the federal minimum wage, which is still only $7.25 an hour times 80 hours. So we'll see in a minute, but this is something that the state is looking at automating some data checks on, so people won't have to continue, have to report their hours in all cases. And then Dan kind of alluded to the opposite of this earlier, but just want to note for adults who don't meet the work requirement, so they're not meeting, they're not exempt, they are supposed to be doing this, they're not going to be able to get financial help on the marketplace. So that's a really unfortunate component of this as well. Next slide, please. Yeah, and then there's exemptions. So requirement basically 80 hours a month or being in school at least part-time. And then there's all of these exemptions. So, age we've already gone over, under 19, so that includes our 18-year-olds, or over age 64. You are exempt. If you're on Medicare, you're exempt, or if you're pregnant or up to 12 months postpartum, exempt. Parents, guardians, caregivers are exempt if their kids are under age 14 or if they're taking care of somebody with a disability. Then we have this other bucket that has a lot of different things in it, and some of these are still being defined. As Greg mentioned, we're kind of waiting on some guidance from the federal government here. But there's going to be a bucket of people who are medically exempt because they have maybe substance use disorder, they have a serious or complex medical condition, they have a disability. And so that is a bucket that's kind of being defined, and we'll have more specifics on soon, but just want to flag that as well. Another one I just want to mention really briefly on here that I have gotten questions about is people who are recently released from incarceration are exempt for 3 months after they're released. Although to note, it is possible, depending on their circumstances, they might meet another exemption, right? Like perhaps they have substance use disorder, they're going into a substance use treatment program, something like that. Next slide, please. Yeah, and then here's what we know about how this will be implemented. So first, want to mention that states are required to check data sources first to see if someone is meeting the work reporting requirement, or is exempt. So that is key. That is a requirement across the US, but Virginia is working particularly hard to automate this and reduce paperwork as much as possible by trying to use as many data sources as possible. So how can they get data on, school enrollment? They already have access to a lot of data sources on income that can be used to verify, to see if somebody's making that 580 a month, or even to see, if they have a job and maybe some hours. So they are working hard to automate this as much as possible so that way people won't have to report. We know if somebody's newly applying in 2027, they will have to meet the work reporting requirement or an exemption for the month prior to when they apply. So the state will be looking back 1 month. All right, were you working 80 hours? Were you in school? Were you exempt? And then if that's a yes, then they'll be enrolled for the next 6 months. For current Medicaid expansion enrollees, they become subject to the work requirement at their 2027 renewal date. So this will be kind of staggered for a lot of people, right? Like if somebody's renewing right now for June 1st, they wouldn't become subject to this until June of 2027. And again, the state's giving people the benefit of the doubt here. They must have met the requirement during at least one of the 6 months prior to their renewal date, but doesn't have to be all of them. I think I've said the last bullet enough times that we're still waiting on a lot of details. So basically, it's a look back, and the state is trying to automate this as much as possible so people won't have to report if they can verify in data sources. And then next slide. I think this is my last one. Yeah. So staying in the know, I mean, this is evolving, of course. So definitely, if you're not already, please subscribe to our Sign Up Now newsletter for updates. We also will have a lot more upcoming training options this summer and fall. DMAS has a good webpage on their website that I have linked here. Includes updates and FAQs on all of these, and they're going to continue to be updating that. Right now, I know they're working on a toolkit of information with outreach materials that I think will be really useful for organizations like yours. And then this last one is a question I get all the time. What should I tell people with Medicaid to do now? Like, what should I tell my clients, my patients, people I know who have Medicaid? Really nothing new yet. Keep doing what they're doing. Always important to report any changes, especially now, and especially if somebody moved. So the state has the most up-to-date information. If you've been doing this work, you know that the main way of communicating is through the mail. So it's really important that any moves are reported either to your local DSS, you have your DSS partners in the room, or through the Cover Virginia call center. Also checking mail regularly, opening notices, replying, providing information, and then accessing medical and dental coverage now, right? Keep using Medicaid to get needed care. I think this is really important too. If somebody's been putting off something, now would be the time to do that. So just really doing all the best practices of having Medicaid coverage, and just, how important those all are, even more so now with these changes coming up. So that is all I had today. I'm happy to take any questions, and also happy to come back at a future presentation. Thank you so much for having me.
Joanna, thank you. Are there questions? If not, we want to thank you. You will definitely be called upon. I got your number. You can't run. You can't hide. The other thing is, I know you guys have good information that when we normally go out for community-facing events, are there new documents you have that would be helpful for us as we go out? I know I'm having health fair starting next Saturday, that we're going out in the park and meeting people, and just to kind of summarize all the stuff in one concise place. Is there some new pamphlets, flyers that you guys have?
Not yet, not for your Saturday event, unfortunately, but hopefully next month. We're kind of waiting on some stuff from DMAS and then can share that around and we'll certainly develop some sign up now stuff as well.
Yeah, yeah, because I know I still have the old renewal process, as we were
Yep.
doing Medicaid unwinding, what that looked like. So that's kind of like the best thing I got, or the latest, greatest thing that I got in my bag now. So there's nothing newer than those documents.
That's right. Exactly. But
Yeah.
soon, because I totally agree. It's time for some new materials.
Okay. Again, thank you very much for taking the time out of your schedule to do this for us. You are our source of information, so we'll come to you as new information becomes available. If you keep
Likewise.
on your mailing list, I would appreciate it.
Absolutely. Thank you so much, Greg. Thank you, everybody. Have fun tonight. I see a lot of good snacks in the room.
Oh yeah.
And thank you for thank you for all
Oh,
that
yeah.
you do. Really appreciate it.
All right, thank you now.
Okay, bye.
Bye bye.